If you have a business or a platform centered around ADHD and I've offended you, or what I'm about to say offends you, I don't particularly give a shit, okay? Hello everyone, my name is Dr. Thomas Hughes. I am a child, adolescent, and adult psychiatrist here in Southern California. Today's topic is going to be about an article that I came across recently speaking about the need for more objectivity when it comes to diagnosing ADHD. Listen, this is something that I've been advocating for a long time. You know, it is no secret that over the past few years, even before COVID, that adult ADHD has been a topic of controversy and discussion amongst providers and amongst patients. In my opinion, we haven't actually gotten very far with that discussion. There have been tons of articles in newspapers, posts on social media, arguments on professional message boards like LinkedIn, but no one's really been able to do anything about it on a large scale, okay? There's still the overdiagnosis of young boys, the underdiagnosis of young ladies, and there is now, again, over the past few years, more widespread overdiagnosing of adult ADHD and overprescribing of medications amongst adults, okay? This is not the biggest issue that I think our society faces today, but it does fall under my purview, so I'm gonna speak on it. Thankfully, this article points out that leaders in the field are actively working on updating guidelines that are more appropriate for today's climate. And when I say today's climate of 2023, I am of course speaking on social media advocates and profit-based mental health platforms that need more ADHD diagnoses in order for their businesses to thrive. Now, before I go any further, let me just say this, all right, real quick. If you have a business or a platform centered around ADHD and I've offended you, or what I'm about to say offends you, I don't particularly give a shit, okay? I'm not here for you. You know, I'm here to encourage the best treatment for the citizens of the United States, okay? An accurate diagnosis for people that actually have ADHD, okay? Sometimes being an advocate for the best treatment doesn't mean that everyone that thinks they have ADHD has ADHD. Sometimes you have to say no. And I'm sure that most advocates out there are acting in good faith, but I think even those acting in good faith can agree that there are bad actors in the field. There are pill mills, and there are people that do actively intend to spread bad information to their viewers for the sake of followers, okay? And it is to them that I actually do hope that I'm insulted, okay? I'm A-okay with that, okay? Because some of you are just profiting off of all of this chaos, all right? So hit dogs holler. If I'm talking to you, I'm talking to you. But if I'm not talking to you, then, you know, we can just move on. I've been doing this for what I would consider to be a long time. I've run ADHD support groups. I have diagnosed people with ADHD. And I've also told people that I don't think they have ADHD, right? And during those times, I have seen people who get a diagnosis be disappointed, okay, that they've been diagnosed with ADHD. That's not news that they wanted to hear. And I've seen people that feel a sense of relief that they've been diagnosed with ADHD. And I've seen people that didn't get a diagnosis of ADHD that feel a sense of relief that they don't have the condition. And then I've seen people who don't get a diagnosis that are disappointed. And then I've seen people actually get angry about it. Okay, so I've seen all different ways of giving that information and then receiving that information. And then I've also seen multiple different levels of treating the condition, okay? With all these things that I've seen, I can tell you that I agree with what this article was trying to say and what this article mentioned, which is that ADHD is one of, if not the only, diagnosis that we can use objective measurements to diagnose. And if that's the case, I don't understand why we wouldn't use it. You know, Most other diagnoses, again, this is from experience, most other diagnoses in the DSM are for the most part subjective. Depression, subjective. Anxiety, subjective. And to some degree, bipolar disorder, schizophrenia, all have some level of subjectivity, either from the person giving their history or from the person doing the evaluation. Now, again, after all the things I've seen and done in the field, I feel the need to stress that when you have access to something that can give you objective measurements, I am of the opinion to say that we should use it. Okay? There's going to be providers out there, and again, advocates for ADHD that say that requiring a computerized test, which is one of the more accessible ways of having objective measurements, or a neuropsychological assessment to diagnose ADHD, is just putting up a barrier. But I'm going to repeat, if you have access to objective measurements, that is the way to go. Okay? Lots of docs could use or could diagnose physical conditions based just on history and physical exam, but we still use EKGs, we still use x-rays. The computerized tests for ADHD is just a move in that direction, confirmatory, which is a good thing. The tests are oftentimes covered by insurance. I think that's an important point. And even if they're not covered by insurance, they are much more affordable depending upon the provider that you go to than neuropsychological assessments, So in that sense, it's not so much a barrier, It's no more of a hurdle for somebody to have to go over than having to go to an hour-long assessment to answer a bunch of personal and uncomfortable questions for every other condition in the DSM. I have personally noticed that patients that get more objective measurements, such as computerized tests, actually appreciate the increase in objectivity versus just the subjective questionnaires. So, I'm just going to repeat myself. For those influencers or for those providers that consider themselves advocates for ADHD patients, my comments today were not so much directed at you, okay, but for the betterment of the field and the way we treat ADHD in this country. If you're offended, I'm sorry to hear, but that sounds more like a personal problem, okay? There should be no reason that people take or have an issue with trying to increase objectivity for any diagnosis, okay? So instead of pushing against computerized tests or pushing against neuropsychological tests because you think it's a barrier, let's work on finding ways to increase access to those tools or to those resources. Okay, that's all I got. Take a look at this article. I thought it was pretty good. Obviously, I agree with everything in it. Some people might not, but I think it's a good article written by Dr. Teresa Cerulli, okay, and reviewed by Ray Parker, all right, in Psychology Today, printed July 20th. Again, take a look at it. I thought it was pretty good. Anyone watching this, thank you for tuning in. Have a great day. I got nothing else. Bye-bye.